Pedro, as somebody that travels around the country and trains at fire departments, every time that I even bring up the concept of someone going to a treatment center or a treatment facility or going through a program for critical stress or PTSD, the very first reaction is, we don't have the money for that. And I know that this has got to be a struggle across the country with insurance the way that it is, a lot of changes going on right now with insurance, but you're the one that makes that happen. How do you make that happen?
Well, what we do first is that we have a process where it begins at the admission process, where a potential client would call, let us know what's going on. We actually do the screening, we ask the questions to find out what the problems are. Then we take a look at the insurance. And a lot of people don't realize that there's provisions within the policy that covers them for the treatment. And so it's my job to make sure that they're afforded the allowances that are written in those insurance policies.
As a responder, are we talking about my department's insurance? The insurance I would have through a department? Would that be my health insurance? Exactly what insurance are we trying to utilize to send one of my men here?
Well, you could utilize the department's insurance if they have individual policies. Almost any policy has coverage for people to come to treatment. Substance abuse and mental health are a big issue, especially when it comes to first responders. There's a lot of trauma, a lot of things that takes place that they don't realize they have the coverage for. Also, until as recently as late, there's sort of like a code of silence where the guys don't like to talk about it. And as you know, it's the inside pain that hurts us the most.
So it's not always the obvious problem. Oftentimes, are we allowing the problem to get worse because of this?
By not addressing it, by ignoring the problem does not by any means make it go away. These are things that need to be addressed. They're like bubbles underwater. Eventually they will make their way to the surface. Now, are you prepared and how you handle that, it makes all the difference, and that's why your job is so important, to bring this to the attention of people.
How often does it end up becoming an issue when you're talking about perhaps a rural responder? Thinking about the years that I spent on a rural fire department, our department we didn't really have insurance, like a big city. We didn't have some of the things that a larger city can afford. Does it, at that point, do I look at my personal policy? Is it just as friendly for treatment then?
Typically yes, but like we have a guy that handles all first responders problems when they call, and the best idea is always to call a representative who can best argue your case for you to get you the help that you need to get. What I've found in my experience is that it does not get better, it gets worse if not addressed.
So overlooking the insurance just because it seems like a big issue is probably the worst idea.
Right. By all means, if you have insurance, you need to look into those policies because you should be covered. If you're not, then you need to get insured.
Now, obviously, I stand with a majority of the country right now. The concept of insurance is confusing to me right now. Is this something that you would walk us through when we called?
Absolutely. I work for a company called Supportive Healthcare. We also do billing as well. And we walk you through the step. We have a staff that gets on board, talks with the insurance company. What we do is we provide the documentation to validate a reason for the level of care that we're requesting. We get authorization for days to get you in treatment, and we also do concurrent reviews to make sure that you stay in and get the help that you need. But you do need a professional. You need somebody that's educated and knowledgeable to get you through this process, to get you in and get you the help that you need. Most people are paying for this. It's coming out of their checks, and they have no idea that they have this coverage.